Welcome, everyone, to PharmCast for the Community. I'm your host, Dr. Tim Brown. Today, I actually am bringing someone on board to get us through the Thanksgiving and Christmas holidays because if you guys are like me, I can't seem to stay away from food these days. The pandemic, quarantine, stress, elections, all those things are sort of mounting up. And so we're going to discuss digestive health. But before I get there, I want to remind you guys, we're going to take December off. I don't know you're brokenhearted, but we're going to take December off. And we're going to come back in January, and Kay Brooks is going to join me, and we're going to talk about tobacco products, how to stop smoking, and help with those New Year's resolutions. And Kay is a genius at this and has been doing it for a long time, so I'm really excited to hear her tips. As a former smoker myself, I want to hear what she tells folks and what to go through because it is a big, big issue to stop use of tobacco for your health. Now, before we get to January, of course, we have to get through November. And I have Dr. Tara Koehler joining me. Hi, Tara. How are you?
Hi, I'm great. How about yourself?
I'm doing well. Thank you for taking the time in this busy fall to come on board and talk to us about our health system when it comes to GI, gastrointestinal, and digestive health.
Well, thank you so very much for having me. I'm very excited to talk to you and your followers.
Thank you. Well, I want to remind everybody that Dr. Koehler actually graduated from the University of Georgia with a Doctor of Pharmacy degree in 1999. It's board certified in ambulatory care. We share that, by the way.
Oh,
That
fantastic.
exam was difficult, wasn't it?
But it was difficult, and I don't know when you took it, but I took it in 2016, first year they offered it. So
Same.
It was very interesting.
Yes, I agree. So many people don't realize that pharmacists are board certified. And by being board certified ambulatory care, it talks about your specialty with working with people that are not necessarily in a hospital, but more in an office setting. Also, I know that you work for Digestive Health. And how long have you been with them?
I've been here a little over 4 years now. I am at the Digestive Health Center at Augusta University. I work with our gastroenterologists, our advanced endoscopists, our nurse practitioners, our PAs, and then of course all of our nurses and our office staff. And it's been wonderful. And I do actually have a pharmacy technician that works with me as well to help with prior authorizations. Because we're a specialty, a lot of our medications do require a prior authorization through insurance.
Got it. So for all those in the community out there, she's talking about those guys who like stick that tube down your throat.
Mm-hmm.
And also the people that actually, at the age of 50, ask you for that colonoscopy to help you keep cancer away.
It's 45 now. American
45?
Cancer Society says even without any risk factors, everyone should be screened first time 45.
That's, I think for people to hear that and realize that pharmacists work within this setting to help out physicians and nurses and PAs when it comes to all the different management that we need to do for this particular area of the body. I think the other thing that people, I love the fact you're board certified, but I know you had a master's in public health as well.
Absolutely.
So you must have a really big commitment to keeping everybody healthy, looking at guidelines and preventive health and those kinds of things.
Absolutely. Well, working in an academic medical center, we are very guideline driven, but population health, public health, preventative health, very big passion of mine. So we always make sure our patients are up to date on their immunizations. We like to tell everybody about screenings that they should be having. So we're very proactive in trying to help prevent some of these diseases before they start.
See, I love that. I love the fact we're going to talk about digestive system in a minute, but it's more than that, right? It's screening for cancers, it's vaccines. And I love that pharmacists do so much. I mean, obviously it just speaks well of our profession, but I'm just so pleased to have you on. And I know that being a grad of UGA, I'm so pleased that others can see what pharmacists can do with their degrees as they graduate from our program.
Oh, well, thank you. Absolutely. I absolutely love my job. I feel fortunate every day to be able to come to this clinic and be able to help our patients in all different ways. So I am very thankful for my career.
Let's see. Now, I know that many people may not realize this because it snuck up on me. Thanksgiving is actually this month, and not much further behind that is Christmas. Although someone was joking me today that we've had Black Friday sales for the past month, being advertised. But one of the things that as I was thinking about what to do in November I realized that this may be one of the first times families kind of have a chance to come together with everything that's going on by getting tested before they sit down for the meal, by making sure everybody in the family is up to speed, and certainly protecting those people that are at risk from spread of the virus. But I have to admit, I'm kind of excited to go see my family. And not that I don't get excited to see my family, just this year it feels a bit more special to me.
I would agree. I think
Uh,
that a lot of people have really suffered from being isolated from other people, and it's just not a normal human condition. We like to be around other people. So for us, for our family celebration, we are actually meeting at a campsite under an outdoor pavilion because my father-in-law is immune suppressed. And so we all want to make sure we protect him. So we're still going to wear our masks. We're still going to keep our distance. And we're going to be outside. So we're thankful to live in Georgia, where you can do that in December, and not be up north where some of my cousins up in Massachusetts already have snow.
they do. Yes. As we go into this, one of the things that you point this out as well, I think we're looking for a reason to celebrate, right? We've had so many things that
Absolutely.
haven't been perfect this year, and people are looking to do those things. And food, as I mentioned as we introed this show, is sometimes that way that people kind of take solace and they're like, you know what, I deserve this today because I have been through all these things. I want to bring you on board and talk a little bit about digestive health and sort of celebrating Thanksgiving in general. So I have to ask, what's the number one complaint? Do you hear complaints go up after the holidays, or is it all year long?
So I think for us, because we are a specialty, we see patients when they are refractory from reflux disease. And so we don't per se have an increase of reflux patients during the holidays because we're getting them referred from primary care clinics all
All
year.
year.
And refractory reflux disease means that these patients have been on an acid suppressant twice a day for at least 12 weeks and are still being symptomatic. But we still remind our patients that are coming in for reflux disease about some helpful hints to avoid some of these holiday pitfalls because everybody is excited and they're eating different foods, they're eating more foods,
Sure.
they're not following their healthy diets. And so we do like to remind them, and we do have 2 dietitians in our clinic that go and talk to our patients, especially during the holidays, to just kind of re-educate them on what to do and how to avoid some of those pitfalls.
So I think, when Tara and I are talking about reflux disease and refractory, what basically means it's heartburn that won't go away, even though you've been to the drugstore to buy the medication. So what I find during the holidays is we tend to overeat, drink more alcohol than we should. And honestly, the stress is kind of there too, just planning it and getting it done. So it's interesting that you're talking about acid suppressant drugs. I think a lot of people, call them heartburn meds or heartburn
Right.
drugs. Um, when you talk about that, I think drugs are certainly something we use, but what steps can people use to sort of minimize making their heartburn worse or giving them heartburn for the first time during this busy holiday season?
Absolutely. Well, there are several things you can do as far as lifestyle changes without even touching medications. One thing is to eat smaller meals, to avoid really fatty or fried foods because they sit in your stomach longer and they make your stomach kind of pooch out or distend. And that distension will actually put pressure on what we're going to call our little muscle that separates our esophagus and our stomach. It's called the esophageal sphincter. And it's particularly your lower one, the one that separates your stomach and your esophagus. And so you want to try to avoid stuff like that or foods that trigger your reflux. So for some people, it's caffeine. For some people, it's alcohol. For some people, it's chocolate. We already talked about the fatty foods. Some people, it's spicy or acidic foods. Now, the American College of Gastroenterology, which is one of the organizations that we follow for our guidelines, they don't actually recommend global elimination of those foods, but if you know something triggers it, they want you to avoid that food that is your personal trigger.
That's your trigger.
Yeah, but other things like don't eat late at night. Don't lay down right after you eat because
Right.
that food will come right back up.
It changes
Uh,
the pressure, right? When you lay down. Yeah.
Absolutely, absolutely. It's just asking for the pressure to go back up into your esophagus. Also, you can elevate your head of your bed, and I don't mean wedge some pillows under your neck because that actually does not work. But if you put a wedge under your mattress, or if you put bricks underneath the little feet at the head of your bed to make it elevated like this, then your head's up here and your body's down here, and there's less chance for reflux.
Or if you have one
Um,
of those brand new ritzy beds, you could just put the head of the bed up a little bit. Yeah.
right, right,
So
right.
you said something interesting, and I was sort of following along, but so Thanksgiving's here, and you said smaller meals. Would it be appropriate to say, you know what, just take smaller, like Dolly Parton says, eat what you enjoy, just eat less of it.
Right.
So like little small portions, it's okay to go back if you want for, a second course or second helping, but like just spoon out maybe a little bit of everything and not fill your entire plate.
Absolutely, absolutely. Unless one of those foods that you really want to eat is a trigger for your reflux, and then you still should avoid that food.
Got it. I was reading an article the other day I thought was really interesting. Use smaller plates.
Mm-hmm.
I thought, how genius is that, right? Just that way you don't have as much space to fill
Absolutely.
up.
Absolutely. Well, I think we all think that our stomach is actually larger than it is. And I think we've all heard that saying that your eyes are actually larger than your stomach. And I definitely think that really does play into reflux disease, because when you fill up your stomach, there's only so many places it can go. And if it's sitting in there for a long period of time, there's a greater chance it's going to start coming back up that esophagus.
That's a really good point. You talked about living in Georgia, us being down south. One of the things that I've always heard is, have a meal, and before you have dessert, go do something. Go outside and play with the kids, take a walk. I know if it's snowing, it's a little bit more difficult, but do something a bit more active before you just go directly into the big, heavy dessert at the end.
Yeah,
And then
absolutely.
you said this earlier, alcohol.
Mm-hmm.
I think alcohol use has gone up a great deal during this
So.
time, but alcohol can trigger heartburn, right?
Absolutely, absolutely can. So again, the American College for Gastroenterology doesn't say you absolutely have to eliminate it, but if it's triggering your reflux, particularly like red wine can lower your pressure for your esophageal sphincter, so that can cause that reflux. If you know it's your trigger, you should be abstaining. And also remember that, for a woman, 5 ounces of wine is a drink, and 1 drink a day is moderation. And for a man, only 2 drinks a day. So I think sometimes we break those rules over the holidays. We just need to keep in mind that even though it's a holiday, we should still be staying in those guidelines.
Right.
Because in our clinic, we also see liver disease, and you don't want to go down the alcoholic cirrhosis liver disease.
It's a good point. You bring up a wonderful point too, that sodas, juices, those kinds of things also can be triggers for people. So it might be worthwhile to put a glass of water
Absolutely.
inside your Thanksgiving day, for every glass of
Absolutely.
wine, maybe there's a glass of water somewhere in your future. It's a really good
Fantastic.
point.
Mm-hmm.
I think the other thing I hear from folks is certain medications give me heartburn.
Right.
And they're like, well, I'm not going to take my medication because I know I'm going to eat a lot today, or I'm going to have that extra glass of wine. Can we speak to like people not taking their medication? That kind of scares me a little bit.
Well, that is a little scary. So there are a couple of different things that happen. There are some medications that just irritate your throat. And it's actually, they give it a technical term. It's called pill esophagitis. And so it actually inflames your throat. And so probably when you've gone to the pharmacy, you've picked up these medications, like for instance, tetracycline is an antibiotic. Your pharmacist has probably said, make sure you take it with a full glass of water. Or for our patients that are on water pills and they have to take potassium, those potassium tablets are really large, and potassium is known to irritate your throat. And so your pharmacist will say, make sure you take that with a full glass of water, or even a little bit of food afterwards. Actually, potassium does need to be taken with food. And that's to help make sure that that pill gets down there and doesn't stay in your throat. Because those pills, like Pradaxa, which is a blood thinner and used in our population, usually for atrial fibrillation, which is a heart problem. Those pills, if they get caught in your throat, can cause severe inflammation, and that can eventually actually lead to a perforation, which is a hole in your throat, which then you have to have surgery for. So when a pharmacist or your physician tells you to make sure you drink it with a full glass of water, make sure you're drinking it with a full glass of water, and then don't lay down for at least 30 minutes or an hour before you've had something like that, because you want to make sure it gets all the way down into your stomach before you lay down and let it kind of creep back up.
Yeah. So if you're on, like you gave, Pradaxa is a great example. You don't want to go with your Pradaxa on the day of Thanksgiving, just because it's Thanksgiving.
Right.
That keeps strokes away. Yeah. The other one's bone, people who take certain drugs for their bones when they have weaker bones.
Absolutely.
I just hear people say, I'm just not going to take it for that one day. It'll be okay. And I, as a pharmacist, say, yeah, I would tell you, I would be really hesitant to tell you to stop anything.
Absolutely. No, I think that those medications that are your chronic disease medications need to be taken. They just need to be taken properly. If you take it with a full glass of water and you still have some irritation, take it with a little bit of food, but make sure you're taking it.
Right.
And I can remember when they first came out with biphosphonates, because I've been practicing quite a bit. quite a while. And, we were very careful as pharmacists in a community setting, counseling our patients on these new drugs for your bones,
Yep.
because they were known to irritate your throat. And so you had to take it first thing in the morning with a full glass of water, 30 minutes before anything else you ate. No food, no medicine, nothing. And then you could have something to eat or drink and take your other medications. And it's still like that today, because if you don't, you can have some really severe problems in your throat.
Yeah, for those of you who are listening in, it's like Fosamax. I'm trying to think of a couple of the other ones. Actonel, those are kind of the big ones that people hear about. Boniva are out there too.
Once a
But
month.
what we're saying is, don't stop anything. If you have a lot of questions, talk to your pharmacist, talk to your primary care physician, and work out a plan. But I'll tell you the other thing that I hear from my buddies. You're going to love this. I have friends who actually plan the eating ahead of time. They're like, okay, I've got a strategy. But sometimes they'll actually take heartburn medication before they have heartburn. They call it pre-gaming for Thanksgiving, so they can eat like an entire turkey. I'm like, dude, seriously, do you need an entire turkey? What do you think about that? People taking heartburn medications before they even have heartburn.
Is it a great strategy? No. I mean, would I condone eating whatever you want to and then taking a medicine to treat it, or right before because you know you're going to do that? No, I still think lifestyle modification is the best way to go. But is it inappropriate to take it when you know you're going to have heartburn later that day? No, it's not inappropriate. If you wanted to take your, omeprazole or Prilosec in the morning before Thanksgiving because you know you're going to overeat and you're not going to employ your lifestyle changes, it's okay to take it that day. It will still work. It's just not ideal to eat your way into reflux and just treat it with a medicine.
I love how you say that, eat your way into reflux. That's good. Okay, let's go back. Since we're pharmacists, we can't help. We got to talk about the drugs. I brought up these, you said acid suppressants. I talked about drugs that knock things down. There are kind of three areas: the antacids, what we call H2 antagonist,
right,
and proton pump inhibitors. Now, for those listening, I know you guys are like, what the heck? This is pharmacist talk. We're going to use some names to help you out with knowing which ones are which. But of the three I've mentioned, Tara, which one's the more potent, the strongest one?
Right. So if we're going to give it a level, the proton pump inhibitors are the strongest things we have on the market for acid suppression at this time.
And what's a couple of examples from something from that class?
So some brand names would be Prilosec, Prevacid, Dexilant, Acefex.
So omeprazole, I think if you buy the generic version.
Right, omeprazole is the generic, lansoprazole is your Prevacid, lansoprazole. Oh, there's Nexium, which is esomeprazole. So all of those medications are the strongest ones that we have on the market.
And how do they work? I mean, like you said, acid suppression, but I don't think people even understand these do change the way your body is, right?
It does. It gets a little complicated. So inside your stomach, we have something called gastric parietal cells, and they kind of line your stomach, and they produce the acid that we need to digest foods. And so what the Prilosec does, which is omeprazole, the proton pump inhibitors, when you take it, it blocks this little pump called a proton pump. It's actually, the technical term is a hydrogen potassium ATPase receptor. And so it blocks that pump. And so it stops the release of acid into your stomach. And very interesting, on a pathology, a biopsy. So if someone goes in there and they do a little procedure where they take a little sample of your stomach to see what's going on inside there, they can actually tell when a patient has been on a proton pump inhibitor because the parietal cells, the surface area actually gets larger. So they almost look swollen on the top because they want to release stomach acid, but the medicine does not allow them to release that acid.
Interesting, because that means that you decrease the amount of acid you have in your stomach, and that also can change the way you process foods and some of your medications. So I just want people to understand that while they do help with your heartburn, gosh, it feels good when that heartburn goes away, you have to sort of keep on track that you're using these medications. And if you're using them over the counter, let your primary care physician know that you're using them and how often you're using them, because these do not come without their own side effects. No drug is that pure that doesn't have side effects.
No drug is that safe. That is correct. Everything has a side effect.
Right. So, okay, those are what we'll call the more potent ones, probably the ones that most people hear about the most, but there was a class that came before them.
right? So that was your H2 blockers. And so they do work on the same cell, the parietal cell, which is that important cell that lines your stomach that produces the acid. But instead of actually blocking that proton pump, they block histamine receptor. It's a histamine 2 receptor. And so histamine is one of those things that we have in our body that when it gets on that receptor, it signals for us to release our acid from those parietal cells. Also, the histamine is actually responsible for most of the nighttime acid secretion. So you will sometimes see someone on a proton pump inhibitor, but still taking an H2 blocker at night. And that's because they're having breakthrough of reflux in the evening. And they have found that you can use the two of them, not at the same time. A proton pump inhibitor should be taken 30 minutes before breakfast. And if you're taking it twice a day, 30 minutes before breakfast, 30 minutes before dinner. And then the nighttime dose would be a bedtime dose of your H2 blocker.
So, okay. So drugs in this class, that because you can buy these over the counter as well. What are some of these medications? What are they called?
So the generic name famotidine is the brand name Pepcid that you've seen over the counter. There's a generic name called ranitidine. It's a brand name Zantac. And you've probably seen that one more in the news recently because they did find NDMA, which is a chemical that they have found in other medications like blood pressure medications that really signals to our government to recall those medications because they know that that particular contaminant that they think is during manufacturing can cause cancer. And so we had a big amount or a large amount of our patients that were on this nighttime dose of this Zantac or ranitidine that actually had to be switched to Pepcid or famotidine in the evening because we couldn't get the ranitidine anymore.
Got it. And I think a lot of people use Pepcid. They see that over the counter a lot, Pepcid AC. And then the Zantac, I think it scared them when they saw that in the news, which it would me, honestly. I'd want to take something that didn't have that chemical in it. Absolutely. So I guess in looking at these, Tara, do people say that one's better than the other? Let's say I want to take Pepcid AC or omeprazole. Is one of those better than the other? I know we talked about potency, like one's a little bit different in the way it acts and certainly gets rid of acid, but has there any data that says one's better than the other when it comes to heartburn?
Well, as far as like guideline directed treatment for reflux disease, proton pump inhibitors are first line.
So that's the omeprazole and Prilosec and all that.
Yeah. Right. Omeprazole, your Prilosec, your lansoprazole, those are first line treatment. And then from there, if you're having breakthrough, then either going to twice a day or increasing your daily dose is what they do first. And then they don't add an H2 blocker until you're having nighttime breakthrough.
Got it.
So still proton pump inhibitors are the most effective. Now, if you just have a little indigestion or heartburn every now and then, is it okay to take a Tums over the counter? Absolutely. It works pretty quickly, but it only lasts for about 30 to 60 minutes. So you're not going to get a whole long exposure to that. So you're not going to get a long-term relief, but would you get immediate relief? Yeah, they're still effective. They neutralize the acid, but they don't stop acid suppression or acid secretion.
But you bring up a really good point. We've been talking about, using these every day or here or there. There are some people who certainly have heartburn every day, and there are people that we just talked about. They're getting ready to eat a whole turkey,
right?
And so they have a lot of just heartburn the day after. They can take any one of these three categories, but the one that's probably is it probably the cheapest or certainly easiest to get is over the counter antacids.
Absolutely.
You mentioned Tums. There's a boatload of them out there, but they work for people who don't necessarily have heartburn all the time,
right?
And it's so okay.
Yeah, just for occasional use. It's not someone for a diagnosis of reflux disease. It is for a little bit of heartburn or indigestion that someone might experience once in a while, but not for our patients that actually have a diagnosis of reflux disease.
That makes sense. I think, for a lot of people, they take these and they don't tell their caregivers that they're taking them. Like their primary care physician doesn't know. Their pharmacist, if they involved in their care in the office setting, may not know. Mm-hmm. There's some risk in that, isn't there? I mean,
absolutely.
But not sharing the fact you have heartburn all the time?
Absolutely. Well, first of all, if you're having any kind of alarm symptoms, the doctor needs to know. So if your symptom for your reflux is chest pain, well, you need to go to the emergency room. You need to get evaluated. What if you are having cardiac, so heart-associated chest pain? So you don't want to just assume when you have a symptom that it's just heartburn or it's just
That's a
indigestion.
good
If
point.
you're having chest pain, you need to go get evaluated. If you're having problems swallowing, that's not regular reflux. You need to get evaluated. If you have any blood in your stools, blood in your urine, throwing up blood, those are alarm symptoms. You need to go get checked out. If you have a feeling like you have something stuck in your throat, that's not normal for reflux either. So you'll want to get those chest checked out. Also, our patients that are experiencing like hoarseness or like kind of those, they're not necessarily associated with reflux, but they are. So they're not like the common symptoms like, the indigestion or heartburn and regurgitation where you have like a little food coming back. But our patients that have like cough or they're getting hoarseness, okay, your esophagus is getting inflamed, your vocal cords are getting now, inflamed. And so you'll want to get checked out because you might need to be on either long-term suppression. They might need to do some kind of procedure to see how serious yours is. So I don't think you should ignore those, nor do I think you should self-treat for a long period of time. Your healthcare providers are there, they're well-trained, and they're there to help you.
It's a really good point. I think a lot of people are just sort of like, oh my gosh, I don't want to do this. But, getting it, it's called an EGD, guys. It's where they put the tube down your throat. And honestly, they kind of put you out a little bit so you don't even know what's going on.
Absolutely.
But the reality of life is that there's a big chance that if the tissue in the esophagus, that little feeding tube, gets damaged over and over again, it could result in ulcers, which are the holes you talked about, tears, and then, God forbid, cancer.
Absolutely.
So
Absolutely.
that's a really good point.
So long term, if you leave your reflux and you're just self-treating at home, you could end up with erosive esophagitis, which is where you're getting erosions in your throat. You could end up with what they call Barrett's esophagus. And Barrett's esophagus can lead to cancer in your throat. So you want to be very careful. And those are patients that are going to be on their PPIs long term. So they're proton pump inhibitors long term for that treatment. There's something else called eosinophilic esophagitis, but it is usually diagnosed when they go down and they do their EGD. Sometimes it can be treated with a proton pump inhibitor. Sometimes it needs something else. So those are all considerations. So if they're having symptoms a lot or they're alarm symptoms, it needs to be something where you go and you get checked out.
I like that. I think when these drugs used to be prescription, the H2 antagonist and the PPIs, and then they went over the counter. I love the fact people have access to them. I think, it's important. I worry a bit though, that if you're taking one every day and it's not on your medication list at your primary caregiver's office, I worry a little bit about that. All medications are medications. I don't care if you buy them OTC or have a prescription. They're all, I'm a pharmacist. I'm going to tell you, I think they're all dangerous if used inappropriately or you don't follow the rules.
Absolutely. Well, we actually, when they come to clinic, we ask patients all the prescription medications and over-the-counter medications and herbal products. So anything that they're buying that's an herbal product because they heard it was good for them, we like to know that too, because those interact with some of our medications as well. And part of my my position here is treatment of chronic viral hepatitis C. So I am particular about asking patients about any kind of acid suppressant they're taking, whether it be Tums, whether it be Pepcid or famotidine or PPI, because the medications for Hep C now are very, very effective. But if you take some of those with, say, omeprazole or Prilosec, you might not clear your virus. And so you have spent a lot of money on a medication that's not going to be effective. So we're very careful in the GI clinic to make sure we ask patients not only their prescription medications, but their over-the-counter medications and their herbal products and vitamins. You just never know what someone's going to be taking.
I love that. I think it's a reminder to everybody that every medication deserves respect. The other thing that we haven't really talked about, but I just want to throw in because you mentioned this is, sometimes when we talk about pain medications, people use Motrin or Naproxen to sort of get up in the morning, get going. They can make your heartburn worse.
Absolutely.
So, again, talk to someone about that because there might be another choice for your pain, or there might be a way to sort of stop the damage from that particular drug dealing with your pain.
Absolutely.
Well, Dr. Koehler, we've covered a lot for Thanksgiving. We've talked our way through about 3 classes of drugs, walked our way here and there. We talked about not using drugs and how to eat a little healthier.
Right.
One of the other things is don't smoke, right?
Absolutely. So, of course, tobacco exposure can lead to all sorts of different cancers. But as it applies to reflux, it actually decreases the amount of saliva in your mouth, and saliva actually helps neutralize acid. So you are worsening your reflux by smoking cigarettes.
And then I think the other one, which is all of us are dealing with this, is weight gain. Because if you're a little overweight, can't it make the pressure change and increase the chance for having heartburn?
Absolutely. Absolutely. So they've done several studies that have shown as our BMI goes up, so as we gain weight, especially weight in our middle, it puts extra pressure on our stomach, which then puts pressure on that cute little lower esophageal sphincter that we have that stops all that acid from going back up. And so when we put pressure on there, then we get some acid reflux. But also with patients that have obesity, so when their BMI is over 30, they have found that they're more likely to have hernias that can also lead to reflux.
Got
They're
it.
called hiatal hernias. So if you've ever been diagnosed with a hiatal hernia, it really just means a little piece of your stomach is going up over your diaphragm. So where your esophagus is, there's a tiny little hole called the hiatus, and it kind of squeezes up there, puts pressure on that sphincter, and that causes reflux as well.
We're gonna have to get a whiteboard with the diagrams and slideshows up for people. But
I know, I'm sorry, that would have been nice.
no, but at the end of the day, though, the tips you're giving are amazing, because it's not just let's pop over to the local drugstore and pick up some drugs to get rid of my reflux. There are things that we can do within our lifestyle that will make our reflux less, or even probably make it go away. So we've covered a lot of that. So
Right.
I always do this because the people listening in, I want them to remember what we've talked about. If you had to leave our audience with 3 pearls today, 3 tips from our conversation, what would you tell them?
Well, my first tip is I believe in lifestyle changes first. They're not for everybody. They're not going to be curative for everybody, but it's something you can do. It's easy. So eat smaller meals, avoid your trigger foods. Don't lie down after you eat. Go for a brisk walk after you eat. Help yourself digest that food. Make sure you try to abstain from alcohol or drink less alcohol. Try to quit smoking. It's one of the best things you can do for your health. So I always love lifestyle changes first. And being a pharmacist, we both know there's so many side effects to medications that if you can stop it before it starts, that's a great place to be. But now secondly, for our patients that do have reflux disease, don't ignore it. If you have an alarm system, you're having chest pain, and you think it's probably just heartburn, get checked out. Just go and get checked out. I would rather be safe than sorry. So get checked out if you're having heartburn. Get checked out if you're having any alarm symptoms. And then thirdly, if you're going to use any medication over the counter or prescription for long term, just make sure you go over it with your doctor or your pharmacist. Am I still supposed to be on this? Is it good for me to be on this? Can I try a lower dose? It's okay to be your own patient advocate. When you're on something for a long time, ask your doctor, especially when it comes to your reflux disease. Is it something you can start weaning down your dose? Would it be a safe time to do that?
Those are great. To translate into like Thanksgiving and sort of I'll call it the amateur eaters, smaller plates, smaller serving sizes, exercise or walker activity, watch your alcohol. I love the fact you talk about folks when it comes to medications, not ignoring the symptoms.
Right.
So if you're buying a bunch of drugs over the counter, but no one knows you're using them, you might want to share that with your healthcare provider because they may interact with what you're on. And then I love the fact that you approach this as one huge person, not just about their esophagus or their tummy. It's about the entire health of someone.
Absolutely.
So that just, Dr. Koehler, I bet your patients love you. I bet they do.
Well, I love them. I love my job. I'm lucky every day to be able to do this.
We are so fortunate you are taking time out of your busy schedule to come on board and talk with us today. I love the fact that you work within an area that many people don't realize that pharmacists do practice, and that you're having an impact on a lot of different folks. And you took some time to share your expertise with our community today, and I can't thank you enough.
Well, thank you. Thank you so very much for this opportunity. And like I said, I'm glad to be able to do what I do. There are a couple of us that work in digestive health throughout the state, but not very many. So I'm very, very fortunate for the position that I have, and our patients are amazing, and I love to help them in any way I can.
Lovely. So I'm going to say thank you once again, Dr. Koehler, and I'm going to remind everyone that we're taking a break for the month of December for PharmCast for the community, but we're back in January, and we're going to be talking about smoking and stopping the use of tobacco, so it plays in really well with what we've talked about today. However, since I'm leaving you for 2 months, I really want to say to you over the holidays, enjoy yourself, enjoy your families, but do it with some common sense. Don't go crazy, and make sure you protect those in your family that you love, and keep everybody as safe and healthy as humanly possible. My name is Dr. Tim Brown. You've been listening to PharmCast for the community from the University of Georgia's College of Pharmacy, and Dr. Koehler and I welcome you to listen to this, and then I hope it helps you out with your health care in the future. Thanks again.